Hey guys, it's Bonnie. I just wanted to send out a little shout out to Lily Ann B1 for sending me a question about what's in my nursing bag. So I'm going to be talking about that first today, which is a good question because it's constantly changing what's in your nursing bag depending on what clinical you're at. So anyways, here is my nursing bag from my school. Not very fashionable at all. It's like a crummy kind of tote bag. But anyway, you can use your own bag, and sometimes I use different bags to carry my stuff, or sometimes I don't even bring a bag. But anyway, this is the first and foremost most important thing. This is my clipulator. That's the name of it. It's a little clipboard. It's got a calculator on it for calculating dosages, which you'll end up having to do. And then it opens up. I don't know if you're going to be able to see in here, but it holds a whole bunch of stuff in here, and I'm going to show you what's in here. First, I have my nursing folder. This is for my Med-Surg clinical, and this has all my clinical paperwork in it. I carry this on the floor with me at all times. Of course, most important. Are you noticing everything's purple? There's a theme here. Stethoscope. Put your name on it. I don't have my name on mine, but you can get it engraved, or you can get a little tag that you can put right here, which a lot of people do, a little plastic tag. That's a lot cheaper than getting it engraved if you don't want to. Let's see. I have a Carpujet. This is a handy-dandy little thing for giving injections. So you would put the little vial in here and then inject. So this is a Carpujet, so you can look up some more information on that if you're, I'm sure you'll get one of these when you get into nursing school. And then here we have our hemostats, which you will definitely need. So you want to get a pair of hemostats. These are things I always carry in my pockets. Scissors. Do not be without scissors. It's very, very important because people will always need scissors. You don't want to have to ask to borrow somebody's scissors because they don't usually want to let them go too easy. Also in my bag, tape. Make sure you have tape at all times because people will steal your tape or people will borrow your tape. What I do is I actually hang it right here on my stethoscope around my neck so I don't lose it. And then, as you can see, I have about 1 million pens. Sharpie. Sharpie is very important in case you need to write on dressings, you know, or say you're putting in an NG tube and you need to mark the tube. You need to have a permanent marker. Highlighter. This is good for if your clinical instructor is going to go over with anything with you in post-conference, so you could just highlight some things. Always a good idea. Pen light. Make sure you have a pen light because you need to assess those pupils. Look in the mouth. Comes in handy. For me, for each clinical that I have little notebooks like this. And in this, I write all vitals, any important information that I'm going to need to fill out my clinical paperwork. So I bought like a 5-pack of these little notebooks, and they're great. And you just throw it in your pocket and carry it around with you. These are EKG calipers, which we are using this semester. And you'll learn about that in cardiac, but this is how you can actually measure on an EKG by hand. So I would recommend getting these because you're going to definitely need them. Alcohol swabs. Definitely need to have alcohol swabs. I have tons of them in my pockets at all times. Wipe off my stethoscope, you know, whatever you might need them for, or you know, they're good for anything. This I got from my school, and this is a Braden scale, which talks about pressure ulcer risks. this is a good thing for staging pressure ulcers. So if you're new and starting out and you're not very sure about pressure ulcers, this goes through stage 1 through unstageable and breaks it down for you. Beyond that, let's see what else. I just have some other paperwork and stuff in here. And then I also have this guide for giving step-by-step instructions for giving a Lovenox injection, which is just something I printed out at my school. But, you know, any little thing that will act as a guide for you, you definitely want to print out, keep on you. There's many different things you could put in here. Now, for mental health, it's the exact opposite of this. Mental health, you want to bring the bare minimum. We're allowed to bring a folder and a pen, you know, and some paper, and that's it, because you don't want the patients getting into your things, or, you know, you can't give them pens. You know, you have to have just like one pen, your folder, and that's it. But as far as for Med-Surg, everything else I showed you is what I have for Med-Surg, for complex alterations in health, which is pretty much just Med-Surg too. So that's what's in my bag. I hope that helps. I also always bring a like sweater or sweatshirt, because a lot of times it's cold when you get on the floor, and also a snack or several snacks, because you're going to get hungry while you're on the floor. And usually they have a spot for you to keep snacks, but people always forget to bring food, and then they're starving. And money, if you need to go to the cafeteria, definitely a must. So I hope that answers your question. Now, as far as this weekend, let me see. Clinicals was a little bit different this weekend. Mental health, I was on the floor where they keep the acute mentally ill patients. And I was assigned to a bipolar manic depressive patient that was there. She was actually in the stages of mania, and she had just gotten out of jail and basically was brought in and involuntarily committed by her family and the admitting doctors at the hospital. So it was rather interesting. I got to talk to her a bit, and she was very open with me. Got to attend several groups, which groups in mental health are really cool to see how the patients kind of interact with each other. While one of the groups was going on, one of the patients right next door to the group decided to have a complete meltdown and started banging on the walls, and which set all the other patients off. So security had to come, and alarms were going off, and it was pretty wild. But it turned out to be a good day. And if you want to know specifics about mental health, I'm happy to talk about it. But today was Med-Surg, and we were not on the floor today because we were actually learning about trach care and suctioning, which is actually pretty easy because we're starting respiratory now. That's the chapter we're going to be doing. So we really went over suctioning in depth, and we had to comp on it today. But basically you need to know that trach care is going to be trach suctioning is going to be a sterile technique. Anything that involves the trachea is sterile. And if you are using like a handheld suction to just do the right in here in the oral, that would be a clean technique. So you need to know the difference with that. I could do a video about it if you want, about trach care. But anyway, so not too much going on this weekend. This week coming up, I have a research midterm, which should be interesting. And I'm also working on forming a PICO question to do a project, a poster that we're going to be presenting at the hospital. And when I get more details, I can tell you about that too. And then I have a mental health test coming up next week. So I have kind of a lot, and a research paper, which I'm writing on obsessive compulsive disorder. I'm almost done. So, busy as usual. But anyway, it's still going good. I'm chugging along, getting there. If anybody has any other questions, I'm really happy to answer, and I'll do it. I'll fit it in whenever I can. But thanks again. Keep the questions coming, and keep tuning in, and I'll keep telling you what's going on. And I hope you all have a great week. Take care.